Hey everybody, I am Amy Jolly, Nurse Jolly, the kids always call me. I have been here for 12 years now. We're going to talk about some of your licensing requirements for the Child Care Center today. This is annual training that you all are required to do. Please don't hesitate to ask any questions though as we go along if something comes up or if I say something that doesn't quite make sense. Sometimes the school does things different than you all do in the Child Care Center and I might misspeak. So it's okay to stop me and ask me questions. Any questions before we start? No? Okay. The first thing we're going to talk about is preventing and controlling the spread of disease in the Child Care Center. And the number one thing always has been hand washing, right? Washing your hands. This has definitely become more prominent since COVID happened. People are more aware of hand washing, the effectiveness, how to do it. I think more people are also doing it correctly, but still if you go into a public restroom and just kind of wait and as the people come in and out, not that I sit there for 30 minutes, but typically I'd say less than 50% of people wash their hands correctly, adults, not even including kiddos. So one of the things that they want you guys to know for licensing is the different times you would wash your hands, and we'll talk about how. So essentially when you first come to work, you wash your hands before and after any kind of food, so eating, handling food, or feeding a child, and then diapering as well, or using the restroom. So food, any kind of bathroom issues, or handling or cleaning body fluids. So if you wipe a nose or, somebody's little dribble on their mouth from the food they ate for lunch, you're supposed to wash your hands anytime you come in contact with that. It also says before playing at a water table. I don't know that you guys have used water tables for a while, but I thought it was worth mentioning just in case, licensing decides to ever ask a random question. You guys at least have heard of it. And then after handling or cleaning toxic chemicals, we want to wash our hands with soap and water, and always after removing gloves. Now, when we do the drop-off procedures in the morning, I don't know, are you all the afternoon group, or do some of you also help with drop-off in the mornings? Because I know that's a little bit different. Okay, so in the mornings, if you use the blue nitrile gloves, the medical grade gloves, sometimes you'll see people using hand sanitizer in between. And last I saw, you can use hand sanitizer 5 to 7 times for a medical pair of gloves, the nitrile gloves, not the vinyl gloves, not the food service gloves, just to kind of help preserve the supply because they are in such short supply. And because we're in a pandemic, so that's not usual routine care, but just because of the situation we're in right now. But 5 to 7 times, and then you take them off and throw them away. If you are using any other kind of glove, you do need to change them every time. And then wash your hands, and when you're doing the drop-off, you can use hand sanitizer in between. But when you're in your room doing something with gloves, like changing a diaper or food, you wash your hands with soap and water in between. When you wash your hands, you get them wet and then you scrub for 20 seconds. We like to teach the kids, sing happy birthday twice, or their ABCs, or Jesus loves me a couple times, just to get in the habit of that 20 seconds. Most adults don't scrub their hands for 20 seconds. If you look, sometimes 5 seconds maybe, but it truly takes 20 seconds, especially for some of the GI bugs that can be so prevalent, and the reason they spread so easily is if you don't take 20 seconds to physically scrub your hands with soap and water, you're not going to get them off. And then when you rinse your hands, you're kind of rubbing under the water as well, because it's either the physical removal with the scrubbing with the soap, and then rinsing and rubbing that gets them off, or the soap exposure for that amount of time sometimes can break down the cell surface layer and kind of kill the cell that way. There are certain pathogens out there that are not killed by hand sanitizer, specifically the GI ones, which is why soap and water is always the gold standard. There are some pathogens, GI things out there that spread super easily, and you could have it on your hands and submerge your hands in hand sanitizer, 100% alcohol for 10 minutes, and it's still viable. It can still be transmitted to other people. So hand sanitizer is amazing. Hand sanitizer is wonderful, when you're in a pinch. But washing your hands for 20 seconds with soap and water. That's why it's the gold standard, okay? So when can you use hand sanitizer? You can use hand sanitizer. The kiddos are supposed to be 24 months or older to use hand sanitizer with them. Otherwise, you're supposed to use like a paper towel, maybe that's wet with soap, you know, and then another one that's to kind of wipe it off. If your hands are visibly dirty, you know, and you have dirt on them, hand sanitizer isn't going to take the dirt off. It'll kill the germs, most of them, but it's not going to take the dirt off. So soap and water. If you're using chemicals and you're cleaning, you know, cleaning tables or wiping stuff down, hand sanitizer isn't going to take the chemicals off your hands. So you want to use soap and water then too. And okay, and make sure when you look at your hand sanitizer, if you have it here, always look at your labels and just double check. One of the requirements for licensing is if you all are using hand sanitizer, you're using it according to the label directions. So do you know what your label says? They can ask you. Like, how much hand sanitizer are you supposed to use and how long does it have to be on your hands? Just peek at the bottle. Most of them say, you know, use a large amount, rub until it's dry. Some of them, however, will say rub, you know, use 2 pumps and rub for 15 seconds. So potentially you could get gigged by licensing, you know, if you're only using 1 pump and it's 10 seconds. So just peek at your bottle. And the same with cleaning chemicals. Some have a dwell time, like how long it's supposed to stay wet on a surface of a minute. Some are 3, some are 5, some are 10. So, you know, you kind of need to know, just always kind of, it's a good habit, just peek at your labels, just so you kind of know what it is, because Clorox is different from Lysol, is different from generic, is different from, you know, whether it's this or chemicals, and you want to, you know, use something effectively as well. It's kind of pointless to wipe it down and leave it wet for 15 seconds if it's really not doing what you think it's doing. And keep the hand sanitizer out of reach of children. Hand sanitizer can be pretty dangerous to kiddos, even with just a small amount. And even if you are using hand sanitizer with the kiddos 24 months and older, just kind of keep an eye on them as they rub it in. You know, someday they might get the wild idea that they want to lick their hands. It's happened. And because they are so small, it doesn't take a whole lot for them to have issues with like alcohol poisoning or toxicity from stuff like that. Any questions about hand washing or hand sanitizer at all? Alcohol is still the gold standard in the ingredient for hand sanitizer. Some of the other ones who have other, you know, chemicals in them, or, you know, the super pretty glittery ones that don't have alcohol in them aren't as effective. So make sure you're using ones that have at least 60% alcohol, okay? Gloves. So when we use gloves in the center is typically if you're touching any kind of body fluids. You also use gloves to serve food, correct? Like when you're serving food? Okay. And gloves do 2 things. They protect you and they also protect me as long as they're used correctly. So outside, we're still protecting our kiddos when we're using the medical grade gloves and we're using hand sanitizer in between, right? Because those are thicker, they're not vinyl, they're not the food grade gloves. If you do that with other gloves, you can actually break down the material on the gloves, so then it's really not protecting anybody. It's more of an illusion than helpful. So when you have your gloves on your hands, you know, I always like to envision I have like just gobs of green paint on my hands, and I don't want to get it all over me, and I don't want to get it all over my hands. So when I take my gloves off, if I grab the outside of one and pull it off, you know, this hand is still clean, right? And I'd have the outside all green goopy paint on this one. So then if I go up and underneath this one and wrap this one inside and around the other one in my hand, I now have 2 gloves. All the green goopy paint is on the inside. You know, it's just a good visual for me. And then I put the gloves in a plastic bag and tie it off, maybe with the diaper if we were changing diapers. If you put a glove on and it breaks, the integrity of that glove is no longer protective. You're supposed to put a different glove on. Make sense? Questions on gloves? There's all different kinds out there. Obviously some fit better than others. People have different preferences about fit. But you know, it can still be too big and still protect you as long as it doesn't come off or rip while you're using it. It's just a barrier, okay? The other thing I forgot to mention when we were talking about hand sanitizer and washing your hands, I brought hand lotion. Something else you can do to protect yourself that people don't always think of is hand lotion. You don't have to use hand lotion every time you wash your hands, but when we're washing our hands and using hand sanitizer as much as we are now, your hands can get dry and you get those little cracks in there. Well, your skin is a barrier to all those yucky germs out there. If you have cracks in it, you're breaking the integrity of that barrier. So a couple times a day, use a lotion that you like for you as an adult. And if you get super dry, cracked, irritated hands, especially as it gets colder, and the air gets drier, Vaseline. I have been told by several dermatologists, cheap, plain old Vaseline, thick coat on your hands at night, go to sleep that way, or put socks on them, and you don't have to coat the bottoms. Typically it's just the tops and like your cuticles and stuff. And then you can put socks on your hands and sleep that way. It's better than any $20 jar of Aquaphor or Cetaphil or the thick, whatever, however expensive it is for that purpose. Now I can't run around with Vaseline and just use that all day because my hands are slippery and I wouldn't be able to hold anything, right? I bought myself a little tube of Vaseline and I'll just squirt kind of like a glob of toothpaste on the top of one hand, and then I'll just kind of rub it in this way so that way, after I have clean hands, this part of my hands are still clean and I can still like write or, use my computer, and it's just on the tops for a few minutes. Or, if I put lotion on and sometimes the lotion's too thick, then I'll rewash my hands, but I'll just like wash this part so it still kind of stays thicker on the top to protect it. But protect your hands, protect your skin, because if you start to get rashes or skin breakdown, then you have more issues potentially with infection and stuff. Does that make sense? Okay. Now for the kiddos, obviously you can't like be putting hand lotion on them unless they come with all the proper documentation and comes from home. But this is just to kind of help protect you guys. So diapering, I know you guys, some ages do more of that than others. When you put or change diapers on kiddos or help them with the restroom, we're supposed to wear gloves anytime you're coming in contact with any kind of body fluid, and hand washing for you and the kiddo. And remember, especially when it has to do with the bathroom, soap and water, 20 seconds is always the gold standard. It's always the best, just because there are some things out there that hand sanitizer isn't going to kill. And typically it's those GI things. Now, if you can't use hand sanitizer under 24 months for the kiddos, but you still need to wash their hands, what they recommend is like a wet paper towel with a little bit of soap on it and kind of wiping them off too, because those kids on the changing table, sometimes they're all kinds of everywhere and their hands are all up in it, and but that way you just kind of ensure everybody has clean hands. Or when they, you help a kiddo in the bathroom, they wash their hands when they're done too. And then you bag the dirty diapers, and if you had gloves on, you can throw them in the same bag and tie off the plastic bag. I know some classrooms have told me they take it out like at lunchtime, out of the room in the trash and stuff. But that way, it's not just kind of out in the open. It's protected in its own bag. Any questions on any of that? Hand washing, sanitizer, diapers? Okay. So when kiddos can't come to school, or you guys can't come to work, COVID, again, has definitely brought a lot of those conversations to the forefront, right? There's been a lot of dialogue, a lot of conversations, and even some changing recommendations. Recommendations changed again last week by the CDC. So I have given it to, Annette and, Nicole and Karen at the school, but we just follow our playbook, right? Like we follow whatever our requirements are. Now CDC changed it, which means ours might change again a little bit. Essentially, they changed the temperature back up to 100.4 from 100. And they also started talking about, specifically more so for the school, but I think the language included you guys too. If someone has a fever, everybody's worried about COVID. If they haven't had any kind of exposure to someone else who has COVID, you treat it like a fever and you follow your fever guidelines. Everybody doesn't have to be excluded for 14 days for a runny nose. I would never have anybody in school, especially when cedar season starts, right? Between cedar and mold and oak, I wouldn't have a child in school. They'd be out for 14 days, come back, have a runny nose, and they'd be right out again for 14 days. So I think they're kind of trying to find that balance which is why things keep changing. But just know Annette will kind of keep you guys abreast of any of those changes that kind of filter down to you guys. We also want to make sure we as a campus are keeping everything the same. I don't want to be doing something different than you guys are doing at the daycare, or than we're doing at church or Tiny Tots. We have a lot of programs, and we kind of need to be consistent and have everybody look at it so that we are maintaining the same standard across the board. Does that make sense? Okay, so you don't have to worry about that. You'll make yourself crazy trying to keep up with everything. Just know that Annette will keep you guys on top of what's going on. And then other reasons, in a daycare, kiddos typically are excluded from schools if, some rash pops up and we don't know why, or, they have a temperature, they start having trouble breathing. Obviously that can be a little bit more of an emergency. Diarrhea, vomiting, and immunizations. All kiddos need to have an immunization record up to date. You guys don't have to worry about that part. The front office, keeps up with that, or some kind of, exemption that's signed off. But, that way we do have that on file. That's a lot of information really fast for the first part. Before I move on to medication specifically and food allergies. Yes, ma'am, any questions?
I have a question about temperature taking.
Mm-hmm.
Does it seem like the infrared thermometers are running low?
A little bit. And here's why. There's a couple reasons for that. One of the things I've noticed for user error is some of the infrared thermometers have a mode button, so they can either check the temperature of a person, and there will be a little picture of a little smiley face, I think, on it, on the little screen, or they have a mode to check the temperature of, say, the surface temperature of a bottle. So if you want to check the surface temperature of a bottle before you give it to a child. So if you look at the screen and it has a bottle on it, you're just checking the surface temperature of the skin, not necessarily the temperature of that artery, okay? So there's one thing. Second thing is you have an inch of space, right, ish, between the thermometer and the skin. So if you're outside and it's 45 degrees, that's gonna impact the reading you get. If someone has had their heat blowing on them, on their head the whole time, right, they're gonna run hot. That doesn't mean they have a fever. So, at school, we just pull them off to the side, give them a few minutes, don't let the heat blow on their head for a few minutes, and you'll get a temperature. They do run a little lower because they're scanning that temporal artery, but most people's temperatures truly are not 98.6. They're more in the high 96s to the 97 range. And temperature checking is just a tool we use. It's not an end-all be-all thing. It's just one of the layers we use to kind of try to protect everyone involved. Those thermometers also do get a little bit testy, the sensors, when it's cold outside. They don't like to be cold. So, if you keep it in your pocket and warm it up, maybe use a different one or alternate between if it's super cold outside. They're not very good with a huge temperature variance. That's just some other things I've noticed. So what we do at the school is I have two, well, each loop has one, but the ones that actually touch your skin and go across are a lot more accurate. However, if I'm touching someone, they have to be disinfected between each time, which is why we can't use that kind. So for the super quick screening that we're doing, for the most part, that's why those infrared ones are really nice, because they're pretty efficient and they're pretty fast. And we're not ruining thermometers because they get too wet between being disinfected every time. But if there's ever a question, you can always check it with the temporal, the one that touches the skin, and then that one just has to be disinfected. So that's kind of like our double check there. Does that make sense?
Yeah.
Okay.
I was just wondering, with winter coming.
They're going to be cold. You're going to have to keep them in your pockets. You're going to have to rotate them. Use one for, and then use another one. Yeah, when we started in March, because when you guys were closed for a week and then we opened back up, it was cold some days, and that was kind of a challenge.
And then the heat in the car.
And then the heat in the car, yes, all of it, yes. I mean, those are all variables, but we just kind of do the best we can with what we have and trying to keep everybody safe. So that's just kind of one of the pieces, but that's a great question. Any other questions about any of that? No? Okay. So we are going to move on to medication administration, and then at the end of this, we're also going to talk about like food allergies and anaphylaxis and epinephrine. So I'm going to talk about like epinephrine kind of as a separate piece in detail at the end. So this is kind of more about the other medications that you guys would give here at the center, okay? So a medication for you guys is anything that is a prescription medication or a non-prescription medication, excluding like topical ointments, diaper ointment, insect repellent, or sunscreen. You guys have different forms for that. So what do you use this yellow form for? Are they always yellow? Diaper cream, insect repellent, sunscreen, right? You still have to have parents' permission for that. And Susie Q's mom still needs to bring, you know, the off for Susie Q, right? Like they have to bring it from home. Okay, so that's what this form is for. You have a separate form, which is this one, when Susie Q's mom brings pretty much any other medication into the center. This is the form, whether it's prescription or over the counter, that says, you know, Susie Q's at the top. Today's the date, you know, the 11th. The medication is, let's say, Tylenol. It expires on, and you want to know the expiration date. How much is she going to get? She's going to get a teaspoon. At what time, right? Like every 4 hours is needed for teething, every 4 hours for the next 3 days, whatever she wants, and then she's going to sign it, okay? This stays with the medication in your workroom in a little bag so that you guys know you have permission to give this. And then, I know they come in different shades of pink, but then you guys, and they're always pink though, right? Okay, so different shades of pink. It could be any color pink, but typically your forms are pink that then you guys have, and you keep this in the room. And when you go to the workroom and get Susie Q's medicine, and we're going to talk about all the things you check, this is where you write, you know, I, Amy Jolly, you know, I write my name. I can't sign for you and you can't sign for me. I have to write what I gave at what time, you know, a teaspoon of Tylenol at 2 o'clock, okay? The other thing, just so you know, and I think they took infants' Tylenol and Motrin off the market. I think it's only the children's dose now. The infants used to be in a smaller bottle and the concentration was different. They don't make that anymore, right? Or do they? I haven't seen it in a while.
I think under 2 we have to have a doctor.
Okay. There were a lot of overdoses because the concentration of that was different. So the dosing was different. So I could give you, you know, something from this, but it would be a half a teaspoon versus a teaspoon because the concentration was different and there were way too many med errors. So I personally like to always write my concentration on there. So like a bottle of Tylenol is always going to be 165 milligrams per 5 cc's. I just always write it down. That way there's never any doubt, well, how much did you give? Most people know a teaspoon is 165 milligrams. You know, but that's just kind of one of those safety checks for me. So we talked a little bit about, and I don't know if you guys are going to use this or not. I haven't seen Annette to ask her, but there's a mnemonic that I always like to use to remember all of the things to check when I'm giving medication. When you're giving medication, there's a lot of room for error. Sometimes, if there's a med error, you know, there isn't a bad outcome. Sometimes it could be a really bad outcome. And it could be with something as simple as Tylenol. I have kiddos at school who are allergic to red dye. So if they get Tylenol, that could be pretty bad, okay? So you always want to make sure that you check when you're giving medicine and making sure that you have all of these things. I'm going to leave these with you guys so you have the mnemonic so you don't have to write it down if you don't want to. But all the things you want to check, if you remember doctor, like DR, and then timed, T-I-M-E-D. So those are all the things you want to check when you give a medicine. And the first D is dose. The R is route. So are you giving it orally? Is it topically? You know, you guys, I don't think give suppositories, but you know, you want to make sure you're giving it the right way, right? So that's your route. What time or how often, like every 4 hours or at 2 o'clock every day. And make sure you have the right individual. You know, I have several kiddos who have the same last name or who have very similar names. You know, I have a couple of Ellas, I have a couple of, you know, Zachary's, I have a couple of, you know, these. You always want to make sure you have the right individual, the right medication. So if I have an order for Tylenol, can I give acetaminophen? They're the same. But if I have an order for Tylenol, can I give ibuprofen? No, right? So just make sure. Sometimes a parent will say ibuprofen and they mean Tylenol, or they say one, just because for a lot of us those can be interchangeable, but for someone with an allergy they can't be. So just always double check the medication. The E is for expiration date and effect. So I always write my expiration dates in red Sharpie on my bottle. Sometimes that little bitty print for my old eyeballs is just a little too much. Or if I've used that bottle a couple times, you kind of wipe off that little printed date on the bottle and then you can't read it anymore. And it's super quick way for me to check the expiration date. I just write, I write the month and the, 7/21. So July 2021, I have to throw this bottle away or send it home or whatever you do with it. And then the last D is documentation, okay? I'm gonna start at the bottom and we're gonna work to the top because I always like to start with documentation. Because if you don't have a form from mom that says you can give it, you're kind of dead in the water, right? Or a form signed from the doctor or whatever, unless there's an emergency. If there's an emergency, and it's truly an emergency like life, limb, or eyesight, or like some kind of allergic reaction, and you don't have an order for Benadryl for this child, you guys are allowed to give a medication in an emergency as long as it follows the package directions and as long as it's to prevent, some emergent, like dying of a child while you're calling 911. Okay, so that is like a caveat in your licensing requirements. So the documentation, we talked about the different forms. You need to make sure you have parent signature, and that's good for how long? Do you know?
The signature for the...
So yeah, like we have an order for Tylenol and mom signed it today. How long is that order good for? So licensing says a year, but I know you guys change it every time they change rooms. So you guys are well within that year for licensing, but just so you kind of know that it's not eternal. It's not from the time they're 6 months until they're 5. You guys do change it out, okay? If you get an electronic email, like if someone emails Mrs. Wright and says, please give Susie Q Tylenol, and they have Tylenol here, you guys can take that as long as the electronic document can be saved and stored. So that is okay. They can also call you on the phone for a single dose and say, oh, I forgot, to get the order from the doctor or whatever. Can you please give her a dose today at 2 o'clock? So you can do a single dose on the phone, electronically, or have your form filled out, okay? According to licensing. I know obviously you guys prefer to have the form on file on your paper, but just know that those others are okay too. The expiration date and effect is your E, and we're working from the bottom to the top in our doctor timed. Again, quick way, check the expiration date, red Sharpie on it. Oh, I'm good, it's not expired. And the effect, if I'm giving Tylenol, I'm not giving Tylenol for a rash, right? You just kind of want to make sure that what you're giving kind of makes sense with what you're giving it for. Or if you're expecting this intended effect, for example, you guys don't give it for this, but Benadryl is just something that comes to mind. Benadryl is labeled as several different uses specifically for adults. You can take Benadryl, which is diphenhydramine, is the generic. It's labeled as Benadryl for allergies. It's labeled as Nitol for, or Night-Z, or whatever the NyQuil version is, for a sleeping aid, right? So if I'm taking Benadryl to sleep, well, Benadryl can wire some people, so then I'm not getting the desired effect. So just make sure that you're getting the desired effect with what you're giving. And if you're not sure what the medicine is for, it's okay to ask that question, okay? Ask someone else, ask Mrs. Wright, ask the parents. You don't ever have to give something, please, that you don't know what it is or what it's for or what it does, or that's not a good idea. Okay, and then the medication itself. Make sure the label, says Tylenol and my paper says Tylenol. Mom didn't accidentally grab the bottle of ibuprofen, right? Or, something else. And make sure that the label instructions, if it is a prescription bottle, says the same thing that your paper does. Because sometimes those can vary, especially when they're titrating medications, which is more of a school thing, I think, than you guys have here. But ideally, those things match up. And make sure it's the right individual. Make sure the label, Susie Q, mom didn't write brother's name, right? Steve. Make sure the name on the bottle is the same on the form. And then for me, a safety check I always do is when I go up to the kiddo, hey Susie, here's your medicine. And it's just a check. And it's like, oh, I'm not Susie, I'm Stephanie. Oh, right? We're all human. I might have 15 things in my brain. That's just another safety check to make sure that I'm giving the right medicine to the right kiddo. I have admittedly almost given, because I have 2 kiddos that look alike, or I'm thinking about this kiddo because I talked to mom this morning, but I'm looking for this kiddo and I go to this one and I've caught myself. So that's just, and obviously you can't do that with infants, but hey Susie, here's the medicine, so that way it's just a good practice, another safety check. Time, make sure the time is, if Tylenol is every 4 hours, Kathy didn't give Tylenol at noon and you're coming in at 2 and gonna give Tylenol again, because Tylenol is within every 4 hours, just kind of make sure that it's within the time parameter. So that's your T, and you're also gonna document the time you give it. And then the route. So we talked about, is it orally, is it topically, is it, cream for their backside, is it, and then for a route, I don't like mixing liquid medication with like a cup of juice or a whole container of yogurt or a whole container of applesauce, because if they only eat a little bit of it, then you don't know how much medicine they got, right? So you can mix it with a bite or two and then have the container of applesauce or whatever next to it and say, okay, we're gonna take these 2 bites, it's mixed with a little bit of applesauce, take these 2 real quick, and then you get the whole container of applesauce afterwards. So it's better to do it that way. So that way you're sure they got the medicine. And dose. Verify the dose on the label. An easy explanation of that is, for us as adults, ibuprofen, Advil, Motrin, they're all the same thing. But over-the-counter strength is 200 to 400 milligrams. So 1 to 2 tablets, right, of Advil. Well, prescription strength of ibuprofen is 800 milligrams. So a lot of people take 800 milligrams. But if the bottle doesn't say, I can give 800 milligrams, and I don't have a doctor's signature that says I can go over what the bottle says, mom can't give me permission to give a dose outside the parameters of what the label says. Does that make sense? Okay, so then we go back up. We start with documentation, and then we always end with documentation. After you've given it, you make sure you document on that form, I gave Tylenol at 210, a teaspoon. I have my concentration on the form, by mouth, and I put my name, okay? Because someone coming behind you may not know that you gave it, and then they might give another dose. And then document your full name, and we can't document for each other. Any questions on that at all? No? Okay. To store the medications, obviously we keep them out of the reach of the kiddos. Most medications you guys keep in the workroom, in the baggie, with the form from the parent and the medication itself, aside from typically like EpiPens or butt paste. But that's where most medications are kept, because we don't ever want kiddos to get a hold of them. You have a separate refrigerator as well for things that need to be refrigerated. It's not in the same refrigerator that your lunch is in. It's in a separate refrigerator for just medications. And then to dispose medications. If a kiddo leaves the center, if the medication is expired or the medication isn't needed anymore, you can ask the parent, do you want this back? Especially EpiPens, because they're so expensive. We'll talk about that in a little bit, but I always offer it back to the parent first before I just dump it, but they need to come and get it. Okay, what if I don't want to give it or I can't give it, right? I don't know what this is, I've never heard of this. It's, I'm not going to give Tylenol for a rash, like that doesn't make sense to me, something like that. It's always okay to ask the parent that question, but before you refuse to give it, I highly encourage you to talk to Annette, talk to Mrs. Wright and say, and they may have already talked to her about something, and there might be something else going on that, we don't know about. So maybe she can give it then, or someone else can give it then. So, but before you refuse to give it, just kind of talk with her about that. But you don't have to give something that you're not comfortable with, you're not familiar with, that kind of stuff. Okay, any questions on that? No? Okay. Okay, we're going to move on to food allergies and anaphylaxis. Food allergies, kind of shifting gears here, is a big issue, and it's becoming more and more of a prominent issue as time goes on. When I was a kid, people didn't have as many allergies. You can develop food allergies later in life. I didn't find out I had food allergies until I was in my 40s. So it's possible, right? So if something looks like a food allergy, treat it like a food allergy. Even if they've had that thing every day for the last 40 years, okay? If it looks like an allergy, we're going to treat it like an allergy. And we'll talk about what that looks like. But people can develop allergies. There are many theories, about why that is that we won't go into today. But just know that if it looks like, we're going to treat it as such, okay? So what would you see if someone was having, specifically we're talking about food allergies here. And food allergies can be, ingested, so they ate or drank it. It can be something they touched. And even if they didn't touch the peanut butter exactly, Susie Q had peanut butter on her knee from when she had a peanut butter sandwich, right? And she hit the top of the table, so now there's peanut butter under there. It doesn't really go away over time, like germs kind of die after a little while. That peanut oil pretty much kind of stays there. So then a couple months later, somebody who's allergic to peanut butter crawls under the table, and now they have this super crazy rash down their back. They might start having trouble breathing. You have no idea what happened. They didn't eat anything. They weren't exposed to anything that we're aware of, or they don't have a known allergy. Sometimes we just don't know what people are allergic to. I had a kiddo at school. It took us years to figure out what she was finally allergic to and reacting to. It took us several years. So allergists are amazing. There's a lot of testing and stuff they can do, but sometimes it takes them some time to figure out what's causing it, and sometimes they just don't know. So essentially what an allergic reaction is it's your body kind of overreacting to something that it sees as foreign, whether it's, pollen, right? It makes a sneeze, or if someone has a milk or food, peanut or latex allergy, or whatever the case may be, your body is overreacting to that, and then your body kind of clamps down. So, which means you can have trouble breathing, you can have skin issues, right? You can look kind of blue in your mouth or in your nails. You can look like you're struggling to breathe. The little ones you might see like kind of pulling in here, pulling in between their ribs, or pulling in underneath their ribs, like they're really kind of using those muscles to breathe. You might hear upper airway swelling, which you kind of, it sounds like it's up here. So anything here to here, anything airway related, and if they're little guys, they might say, I feel like I have ants on my tongue, right? They might not say the words that we're expecting them to say. Or it feels like I have, dirt in my mouth, or my lip feels fat. Well, you can't really see it. They're going to feel it before we can see it. So if they say anything like that here to here, take them seriously, investigate, see what's going on, see, what their history is, if they have any kind of known allergy, who were they around, see what you can find out. If it becomes a breathing issue, we have an emergency. And sometimes it's an emergency even before you get to that point, okay? Some of the most common allergens, I don't want to forget to mention this, the big 8, milk, eggs, fish or shellfish, tree nuts, peanuts, wheat, soybeans. They're going to try to add sesame to that, and then latex too, so like even latex balloons or gloves. Those are the most common allergies, but people can be allergic to anything. That girl I told you about who it took us years to figure out what she was allergic to, it was the canned peaches from school. It's not canned peaches, because she could eat them at home. It's not peaches, because she could eat those if they were fresh. It was the canned peaches that we had at school, that the only ingredients were peaches and water. They don't have to label all of the preservatives or whatever it is that they use in the foods. So whatever this company was using as a preservative is what she was reacting to. So it took a long time to figure that out, and you might not know what it is. So again, we don't always have to know what it is. Ideally, if we do know, we try to avoid it, because that's the best, is to avoid it if at all possible. But if we can't, and if we're having a reaction, we're going to treat it like an allergic reaction, okay? And sometimes it's known or unknown. Like I said, you could be an older adult and develop these allergies that you didn't have your entire life. So any symptoms from here to here, we're going to treat like an emergency, okay? If they have Benadryl orders, if they have orders on your form, there's a couple different forms. They'll have an allergy form. This is the standard fare one. It's the Food and Allergy Research Emergency Care Plan, Food and Allergy Research and Education. This is their plan. A lot of doctors use this one, which is totally fine. I have a separate one for school, but if my kids come with this, I take this one. I just need a doctor's signature that tells me what to do, and it tells me, their name, what they're allergic to, if I know. I've had forms that say unknown at the top, right? And then what symptoms have they had in the past? Just because they've had that kind of reaction in the past doesn't mean it's going to be the same. It can be completely different, and it can be a lot worse. Depends how much they were exposed to, or if it's fire ants or bee stings, how many times were they bit, how close, was it at their foot, or was it like right up here at their neck? All of those things kind of are into play. And then what medication I can give. Now remember, you guys have, if in an emergency, you can give medication without an order, but I don't think you guys carry stock medication. I have stock Benadryl and stock epinephrine, so you guys can always call me and we can give something before EMS arrives, just so you know. But your form will say what to do, and the first thing you do is always, always, always treat the child, and then you call 911 in that order, okay? Average response time here at Concordia is about 6 minutes, which is pretty quick, but it's an eternity if someone is having some kind of allergy cascade or anaphylaxis going on. 6 minutes with no airway is too long. So you treat the child and then you call 911. There are, if they have orders for Benadryl, you give Benadryl. These are all epinephrine. Now, there are 3 different kinds. We used to just say EpiPens, right? You'll hear the term EpiPen, get an EpiPen. Well, when people say EpiPen, they could mean any of these 3, even though this is the only true EpiPen brand. It's kind of like saying Band-Aid. There's all different kinds of Band-Aid. There's only one true Band-Aid brand, but because of very effective marketing strategies, Band-Aid kind of, associated their brand name with that as the norm, or Kleenex. I could buy Puffs, but it's still Kleenex. So just know that EpiPen is any of these, but this is the EpiPen brand. The reason there's different brands is because this is kind of like the Cadillac. This is the Cadillac version. It was the first one that came out. They had the run on the market forever, for years. The medicine is identical in all of these, okay? It's just the delivery system that's a little bit different. So epinephrine is a super fast acting medication that kind of helps your body relax when it's having that swelling of the airway, or super crazy rash, or their mouth is swelling or their upper airway is swelling. When they're in trouble, this acts pretty fast, but even a minute or 2 is a long time when I can't breathe. So the rule of thumb is epi first and epi fast, okay? When in doubt, this is your answer, okay? There is a little caveat that I will mention, that if it's an adult, they say just be aware if they have a heart condition. Okay, but if I have a heart condition and I can't breathe 2 minutes from now, that heart condition doesn't matter as much as this does, right? So epi first and epi fast. This is never the wrong answer. I want you guys to know that this is always okay. Epinephrine, if you give it to someone who doesn't need it, they're going to feel like they had 8 cups of coffee. They're going to feel kind of jittery. They're going to feel really wired. It acts pretty fast, but it also wears off pretty fast, okay? You're not gonna hurt them by giving this if they don't need it. But if you wait too long, the consequences could be dire, okay? So epi first, epi fast. I have gone through this training every year for however many years I've been working here, but now my brain is stuck because this is the real deal. I've had that huge jolt of adrenaline and now I can't remember what to do. Beautiful thing is there's a picture on the side. Doesn't matter what brand you use, right? There's a picture on the side. Why can't I give this? It's not working, it's not working. Oh yeah, oh look, remove blue safety cap. Oh, okay. So it's okay. That's just a kind of a normal thing that your brain will do when it's under high stress. Blue to the sky, orange to the thigh is how I give this. But it won't go unless I follow step 1 and take off the blue safety cap. It's just that, the safety. So I take off the blue safety cap. When I give this, I always want to make sure I never wrap my thumb around the top. Because if I accidentally have this flipped the wrong way, I could inject that epinephrine right into my thumb, which will constrict those blood vessels. I now no longer have blood flow to my thumb, which is a problem. It's also a problem that this person doesn't have epinephrine that they can get right now. So you never wrap your thumb. You never hold your thumb at the tip. You always want to wrap your thumb. So even if I have it the wrong way and I go to give it, I'm not giving it to myself. The orange end is the hot end, okay? That's the end that you don't want to touch, but that's your hot end. It's ready to go. How I would give this to myself is I go straight down on the side of my leg. I don't have to worry about, I have pants on. I try to avoid the seam if I can. And if it's an adult, just check and make sure that you're not trying to go through an iPhone or keys or something in their pocket, okay? So I go straight down to the side. You'll hear a click, and I count to 5. 1001, 1002, 1003, 1004, 1005, and then I let go. The EpiPen brand, the Cadillac version, is super cool. It has this orange tip that comes out and covers the needle so I can't poke myself. It also tells me I gave the dose. If this is still inside, after I put it on my leg, oh, I didn't give it. I have to do it again. So that's kind of nice about these, okay? And then you're not going to poke yourself. This is an automatic 911 call. Epi first, epi fast, 911, okay? And other people can help you. So you can ask people, call 911, tell them we gave epinephrine, because then they'll send a paramedic on the way who can give more epinephrine, okay? Another brand we have is, this is the generic version. This came out just a couple years ago. These are $800-ish for 2. And if you think about how many sets you need, because at school I need 2. At home they need 2. If they have a basketball bag, they need 2. If the parents are divorced, they might need another 2 at dad's house, because you always want them in sets of 2. And when you pick them up, they're only good for about 14-ish months. So $800 a set times how many sets every year is a lot of money, okay? There's an expiration date on the epinephrine. We try really, really hard to make sure that we have non-expired epinephrine on campus, okay? Sometimes there are recalls or shortages where they will extend the expiration date on the epinephrine, but I want you guys to know and understand that expired epinephrine is always better than no epinephrine. If I have expired epinephrine, I'm going to treat the child, okay, or the person. They did a study where I believe it was 7 years old. The epinephrine was 7 years old, and they tested the effectiveness, and it was still 80% effective. 80% is better than 0%, okay? So yes, we want EpiPens or epinephrine that isn't expired. But if it's expired and I'm in an emergency, I'm going to use what I have, okay? The generic one, so this case is a little bit different. You can't get wild and whip it open because the case is 2 pieces. So if I whip this open, this could go flying right out of the tube because the tube is 2 pieces. If I open this really fast because my hands are shaking and I'm super nervous and that adrenaline is, making me, really strong right now, I can't just get crazy. Just remember that this is 2 pieces and this is inside. So when you open it, just make sure, that you're not flinging this across the room. Now this also has the directions on the side. There's 2 more caps you have to take off though, and it says pull. So you have to take off the 2 caps, and then you have your red hot end again, right? That's the hot end that you're going to give. So same thing, same positioning. I'm going to push and hold, count to 5. Now this one will not cover the needle for you though. This one you will have an exposed needle, okay? Never, 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 ever 2 hands together to cover a dirty needle. You will have shaking hands. You will be moving so fast and your brain is going to be 15 steps ahead of you where you are, right? You don't want to stick yourself with a dirty needle. So what I like to do is I like to have it laid on a table, not in my hand, but just so we can see it. Like this is laying on a table and I'll scoop it, just so it's covered. Because when you call EMS and EMS shows up, you have 5 more people in the room with laptops and bags and all kinds of stuff. Stuff gets pushed out of the way. You don't want anybody to get stuck with a dirty needle, okay? And then AudiQ, audible. It's audible, you can hear it, okay? This one's super cool. It hasn't been around that long, but it'll talk to you. It's nice as long as you can hear it. If it's really loud around you, you can tell people to be quiet, but if you can't hear it, there's also directions on the side so you can still see what you're doing, okay? It'll tell you.
No needle or drug.
But she's not that loud. If there's a lot going on, I can't hear her,
You are ready
right?
to use. Pull off red safety guard. To inject, place black end against
So
outer
this one.
thigh. Then press firmly and hold in place for 5 seconds. 5, 4, 3, 2. Injection complete.
Okay, now she talks to me, but I don't have to wait for her. If I know what to do, I can totally pull this out, take this off, and right to the leg. And she'll keep up with me, okay?
2, 1.
So it's a nice feature, but you don't have to wait for this. Does that make sense? Any questions on the differences of the EpiPens? Anybody? Okay. Do you guys know anybody here in the Child Care Center who has an EpiPen? You do?
I have one vendor, she has one. I have one. My child. Yeah, your child has one. I do have one.
Anybody else? So you may have people here on campus who have them and you aren't aware. If you're new, it's a recently diagnosed thing, right? If I don't tell you I don't have an EpiPen, but if I don't tell you I have food allergies, you don't know. So if you have something like that, it's really beneficial to tell other people. But if you come across somebody who has an allergy or having what looks like an allergic reaction, ask them, are you allergic to anything? Do you have an EpiPen? Because they might have one in their purse. So think about, and you just might not know. Because I can tell you there's other people on campus that have them in your child care center and you just don't know. Now, HIPAA, I'm not going to tell you who they are, but just know that that's always an appropriate question. You look like you're struggling to, are you allergic to anything? Do you have an EpiPen? How can I help you, right? Kind of like when, you're coming up on a scene for CPR. Annie, are you okay? Help. Can I help you? What can I do? Don't forget to ask that question. And then kiddos, they're not going to describe it like you and I would, right? I have ants in my tongue, my mouth feels funny, there's a frog in my throat. They're going to talk like that. And I think that's all I have. Any questions for me? No? Okay. Well, if you guys think of anything, don't hesitate to ask. I can always answer them. And thank you. I appreciate you guys.